Well, joining us now, Congressman Joseph Crowley, a Democrat from New York and the Chief Deputy Whip. So, Congressman, what are you hearing from the American people?
Well, what I'm hearing, Jenna, from the American people, by the way, it's great to be back with you, is they want us to focus on jobs and the economy and how do we improve the economy, continue to improve this economy, and continue to create jobs as we have for the last 11 months. And really, that's what this election was about. And I think it's really about time the Republican Party got that message and started to move on. The people aren't focused on this issue right now. They like what they're hearing more and more about this health care bill as more of it goes into effect. So really, I think this is a lost opportunity for the Republican Party to really set their agenda on what they're going to do to create jobs and improve this economy.
Well, let's just pause for a second and talk about jobs, because you say we need to focus on creating jobs. What new ideas do you have for job creation?
Well, the one thing I do know is that if this bill were to be repealed, it would actually stop job growth. It's estimated that about 4 million jobs will be created over the next 10 years in the healthcare field alone. So this is a job created. This is not a job killer, as my colleagues are describing it. And I think, by the way, that's it's a very impolitic way of putting it. This really is about helping to give people in this country the opportunity to afford health insurance, which they have heretofore, millions heretofore have not had the opportunity to do. When they give to the American people what members of Congress have, that is choice and the availability to purchase their own health care insurance. And that's what the American people want.
One of your colleagues, Congressman King, came up with that language, the job-killing language, when it comes to the repeal of the health care law, and he's going to be our guest in a little bit. And one of the things that he says is even if the repeal of the health care law stops in the House, meaning it's voted through but it doesn't go anywhere in the Senate, that Congress can still cut off funding to health care, and that would pull its roots out of the ground. That's what he has to say. What's your reaction?
Well, you know, the latest poll by the AP has shown that almost 3/4 of America wants this bill to go forward. They may not like every aspect of it, but they want to maybe improve it. And I think the president has said that he's open to ideas to how to improve this measure. I know that we in the House Democratic Caucus have always been open to try to improve this bill.
And where specifically, sir, where specifically do you see opportunity for improvements and also compromise across the aisle?
I think obviously the issue of 1099 and independent filers, that's an area in which we see common ground on with our Republican colleagues. So that's just one example. But wherever there may be an opportunity to improve this bill, we want to do that. I mean, what would they like to take away? Take away the right for people under 26 to be on their parents' insurance? The right for people, children right now who have been discriminated against because of a pre-existing condition that they no longer have the opportunity for insurance, that people in the future who have pre-existing conditions don't have the opportunity for insurance, that they want to give this control back to the health insurance companies and let them decide what health care is given and what is not given. I think the American people understand what this debate is about. They've already moved on. I think they're appreciating more and more what we've done in Congress. And I think it's about time my colleagues on the other side of the aisle appreciate that and move on as well.
Just real quick here, I only have about 30 seconds, but there's such extreme different ideas about what this health care law really means for the American people. And there's a little bit of a confidence gap on both sides, truly, about what exactly will happen when this law goes into place. How do you gain the confidence of the American people that this is the way we should go?
I think the more the American people see what is put in place and what they have to lose by repeal or taking away rights within this bill is actually growing more support for the legislation that we passed. I don't think that we did a good enough job early on explaining exactly what's in the piece of this bill go into effect, the more people appreciate it, like senior citizens who have gotten $250 checks in order to help them fill the donut hole on prescription drugs. They understand what this bill is doing for them. That's going to give them wellness visits for free under the Medicare system. They understand what benefits are derived from this bill, and I think more people understand it, the more they're going to like it.
Congressman Crowley, thank you so much for taking the time out of your day, a busy one,
Thank you, Jenna.
to join us. We appreciate it. Thank you, sir.
Good to be with you. Thank you.
Well, you probably